Thank you very much, and thanks to Epilepsy Ireland for inviting me to speak. I'm a consultant neurologist at the UPMC Beacon Hospital and also at their clinics in Mullingar and Clane, and I spent a couple of my early years not far from here in Athlone and have worked in the past in Portlaoise Hospital, so you could say I'm a bit of a local boy. So I'm going to be talking about exploring epilepsy, health and lifestyle issues. So I'm not going to be talking about treatments or new ways of diagnosing epilepsy. I'm going to be talking about how epilepsy affects our health and about how lifestyle in turn affects that as well. So as an outline, I'm going to look at what I mean by health and lifestyle in the context of the talk. And then I'm going to look at how we measure quality of life and how we measure that. And then I'm going to update you on a very important and landmark report that came out last year called the Institute of Medicine Report on Epilepsy. And then I'm going to discuss some of these lifestyle issues and how we approach them. So what is health? And there used to be a definition that health was the absence of disease, but that's not the case. So people with epilepsy can be healthy. So health can be a sense of well-being. That's one definition. And there are many aspects of it, both physical and mental. Fitness, nutrition, weight, hygiene, sexual health, avoidance of drugs and alcohol. And then on the mental side of health, the ability to enjoy life, to approach adversity, cope with stresses. So all of those are aspects of health. And then lifestyle then is a way of living that affects our health. And there are various definitions, but it's a way of you cope with your physical, psychological and social environment. Your self-image is very important and reflects on your lifestyle, and also the motivations, needs and wants of the individual also affect the way we live our life, our lifestyle. And there's a multitude of different areas and issues that come up when we talk about lifestyle and that affect our quality of life. So it's not all about seizures, and when you're sitting, say, in the doctor's office and they're asking you how many seizures have you had and what medications are you on, that's not where the conversation should stop. So we need to a whole person type of perspective that brings all of these issues as listed there into the discussion. And ultimately it's about quality of life. So you could have a person who doesn't have epilepsy or doesn't have a chronic disorder and kind of a very poor quality of life. You can have somebody with epilepsy who has a very good quality of life. So these are different factors that influence that in any individual: health, safety, work, psychological factors, stress, family factors, spiritual factors, and education. So it has long been recognized that this is an important side of epilepsy to measure, for example, when we're studying treatments and studying interventions to see if they're effective or produce a real change in or improvement in quality of life. So this is one way of measuring it, the Co.Offaly 31 that was developed by a mentor of mine, Oren Davinsky. And so what they felt, or the kind of epilepsy physician community felt was most accurate in terms of measuring quality of life was questions on mood, energy levels, social and leisure effects, cognitive function, driving issues, seizure worry, and medication effects. So this is what physicians will often try to measure, particularly in studies where we're trying to see if a medication or a surgery or anything like that is going to produce a measurable improvement in quality of life. So is epilepsy different from other chronic disorders? Well, it actually appears that yes, it is different from other chronic diseases, and that we're recognizing that the quality of life is lower than for many other chronic diseases in epilepsy. And the comorbidities, and what I mean by that is other disorders that are often seen in people with epilepsy, for example, depression and cognitive dysfunction and osteoporosis, they're more prevalent than in other disorders. So there are many reasons for this, some of which we don't understand, but some reasons are the severity of seizures, the side effects of medications that we use to treat them, and the underlying brain that's involved in the epilepsy can influence that. So this was recognized or has been recognised more and more over the last few years. And so in 2011, a report was commissioned, and this is in the US, by the Institute of Medicine. And that's a very kind of high-level, independent public health forum or organisation that produces these very important reports that influence the way a condition is going to be addressed and researched over many, many years. So this was published in last year in 2012, and it's called Epilepsy Across the Spectrum, Promoting Health and Understanding. So, and again, focusing on the way that epilepsy affects our health and also in the broader public health forum. Now this is extremely busy, but this and I'm not going to read out every one of these. So, but this was some of the kind of figures and reasons why they went to prepare this report. This is from Joseph Servin, who was on the committee that produced the report and is editor-in-chief of epilepsy.com, and it just highlights how common epilepsy is. More individuals in the world have epilepsy than, say, the population of Canada, the entire population of France. There's many new cases every year. We haven't found a cure or can treat it fully or effectively, despite now 38 many new medications that are available. And interestingly, one of the impetus for the report was that it was felt that the access to care for people with epilepsy in the US, in particular, in this case, was not good, and particularly in underdeveloped and rural areas. And I mean, this is the case in Ireland as well. But you can see 32 days average waiting time to see an epilepsy specialist, 25 days waiting time average for an epilepsy monitoring unit evaluation. So if they were concerned about this in the US, you can realize how this can be generalized to the Irish situation as well. So again, the report is called Epilepsy Across the Spectrum, Promoting Health and Understanding, and to examine the public health dimensions of epilepsy. And another major impetus of this was the misperception and misinformation leading to stigma, which is still a major problem, and I know was a topic in the conference last year. So the report's very detailed and has some very specific recommendations, but I just want to highlight a couple of main points that came out of the report. One is that access to healthcare is very important for people with epilepsy. Access to community resources, access to knowledge and education for all people involved in epilepsy, from patients and families and caregivers and healthcare professionals, and that's one of the reasons why we're here today, is to learn more about epilepsy, and Epilepsy Ireland does a fantastic job in education and community resources around the country and advocating for epilepsy. To improve the public understanding of epilepsy, in particular to reduce stigma, and also to address these comorbidities that I referred to, and I'll talk a little bit more about, is a major focus at the moment and has been kind of under recognized and under emphasized in the last 10 or 20 years. The particular groups that it focused on in terms of increasing the level of education was for healthcare providers, so everybody involved in the care of people with epilepsy, patients with epilepsy and their families, and the general public as well. This was another recommendation I just wanted to emphasize as well on engagement, and that's on what you can do, or what patients and their families can do with epilepsy. And I'll just read it out. So that people with epilepsy and their families should, to the extent possible, become informed about epilepsy and actively participate in and advocate for quality health and care and community services. Discuss best options for care with healthcare providers. Consider participation in research. Engage with community professionals to educate them about epilepsy and ensure that needed services and accommodations are provided. Talk openly when possible about epilepsy and its impact on life. Actively participate in support networks and work with non-profit organizations to raise awareness and participate in advocacy efforts. So again, a lot of what we're about today and a lot of what Epilepsy Ireland is about. So I want to move on to talk about a couple of these lifestyle issues then. I don't have time to talk about them all, but a couple of ones that are particularly important. And one lifestyle issue is mental health. And mental health disorders are very common in people with epilepsy, 30 to 35%. And that can be a combination of mood disorders, depression, anxiety in children, attention deficit disorder, and affects both children and adults. And it's associated with people who do have reduced response to anti-seizure medications tend to have more of these issues. So what can we do about it? Well, it's important to uncover these issues and to identify them as early as possible, and they're treatable, and treat them as early as possible. And another aspect of that is to not be afraid to treat these conditions too. I mean, a lot of even physicians are nervous or afraid to start an antidepressant on somebody with epilepsy about concern over will it aggravate seizures or aggravate or interfere with medications, and typically it doesn't. And to address medication, and particularly anti-seizure medication side effects, is also important. Another lifestyle issue that's particularly important is weight. And we know that people with epilepsy are less active, and they put on weight basically, and then that results then in a higher cardiovascular risk with less activity and a higher weight. And that's a real concern over time. And again, it's one of these public health issues that the report has addressed. The anti-seizure medications can have a big influence on that, and many of the medications, as you can see there, are associated with weight gain and some even with weight loss. So the main approach to this really is to monitor weight and to identify any significant weight changes early on, so that then you can talk to your doctor about weight, so you can to talk about diet and exercise, or even changes of medication if necessary. So another lifestyle issue that's very important is sleep. So we spend a large proportion of our lives asleep. And if you don't get a good night's sleep, it's going to affect the entire daytime as well in terms of your functioning. And there are many, many ways that there's complex relationships between sleep and epilepsy, and I've just put a couple of these up here. The seizures and EEG activity are more common in sleep. And certain types of epilepsy predominantly or purely occur in sleep: benign Rolandic seizures, nocturnal frontal lobe epilepsy. Sleep deprivation is a major trigger for breakthrough seizures. So obstructive sleep apnea can be more common than we think, and is now clearly associated with, if untreated, with breakthrough seizures and poor control of seizures. And this can occur in adults, and it can occur in children too, particularly due to, say, large tonsils and adenoids. Obstructive sleep apnea is when you have kind of sleep disordered breathing during the night that can disrupt your normal restorative sleep. And it has been a little controversial, but there are people who have EEG discharges in their sleep at night. Those are the discharges we see in between seizures on for example, the EEG. If they're very frequent, we think that they disrupt sleep and disrupt the normal restorative sleep waves during the night, and then that can then affect seizure control and also even cognitive function during the day. Several of the anti-seizure medications can affect sleep or cause insomnia, so that's an important thing to look at. There's an effect of these comorbidities that we've looked at, such as mood disorders, on sleep as well. And there can be other sleep disorders, or what we call parasomnia. So it's just to give you a flavour of how sleep is so important in epilepsy and in the lifestyle of somebody with epilepsy. What can we do about it? Well, it's very important to screen for sleep problems. So I saw somebody just this week who had epilepsy for about 30 years, and they also had severe insomnia. And I said, well, did you tell anybody about it, or did anybody ask you about it? And the answer was no. And that was probably affecting seizure control. We can do polysomnograms. We also call them sleep studies that can give a detailed study of sleep and identify sleep apnea and other sleep disorders. Sometimes it requires an ear, nose and throat evaluation for people who have sleep disordered breathing. Education is very important about sleep. Sleep hygiene, good sleep practices. Sleep aids have a role, although sometimes it seems like half the population is on some kind of sleeping tablet, and I like to try and avoid them, but there are other ways of using sleep aids that I'll show you. And behavioural methods can also help somebody sleep at night. These are some general recommendations on what we call sleep hygiene, or ways to improve your sleep. Let's stick to a regular sleep schedule, including weekends. Exercise is good, not too late in the day, although some people actually advise some exercise in the early evening. Avoid caffeine and nicotine, particularly after midday. Avoid alcoholic drinks before bed. Avoid large meals and beverages at night before going to bed. Don't take naps after 3, although many people will say just don't take naps during the day at all. You want to sleep just during the night. Find some way to kind of relax or tone down during the night before bed. Take a hot bath before bed. Have a good sleeping environment, or get rid of distractions or bright lights or computers or iPods, those types of things. Don't lie in bed awake at night for too long. If it's 20 minutes or longer, go up, do something, and then try to get to sleep again. And sleep posture can be important. And then seek help if you're still having trouble sleeping despite that, seek some help. Again, I don't like to use sleeping tablets, but I'll not uncommonly recommend, say, melatonin. It's a natural sleep aid. It's a prescription here in Ireland, but in the US it's available in any pharmacy. Here it's $12 for 240 tablets. That's about 5 cents a tablet. It's a naturally occurring hormone, but synthetically made, and can help sleep in many people, although not in everybody. That leads into issues on travel, which is another lifestyle, important part of lifestyle, because if you have epilepsy, you're not contraindicated from flying or going on a nice holiday and vacation, which is very important. But just some tips we often give is to bring some extra medication with you in case you lose some, or some gets flushed down the toilet, and make sure you bring it in your hand luggage in case your bags get lost. And bring your prescription or a letter from your GP, for example, so that you have something to say what your diagnosis is and what medications you're on. Long haul flights can be more of a problem, and because there can be time differences, and you need to be careful about the timing of your medications. I saw somebody recently who got up for the early flight early, and then it was a very tiring journey with some changes, and then they got to their destination kind of late, and so they ended up taking their medication late, and they had their first seizure in 10 years. So it's an important thing to think about and plan ahead of time. Sometimes I'll give on the long haul flight, say to Asia or across the Atlantic, or I'll have somebody take a lorazepam or diazepam tablet on the night that they get there to reduce the effect of jet lag and reduce the effect of sleep deprivation in just that early part after arrival. And the same on the journey back. It's important to wear an identity bracelet as well when you're traveling, and then just make sure you have travel coverage and insurance. There are a lot of alternative treatments. Some people go down this route, some people don't. But it's all good if it helps you and helps to relax you, reduce stress as well. There are people who do like to go down the homeopathy side of treatment and herbal medicine, and there are quite a few herbal therapies that have been postulated to improve epilepsy, and they may do, but they're less regulated, and you need to be careful. They're not scientifically proven to help. There are resources and books out there that give you a lot more detail about complementary and alternative therapies in epilepsy that you can access to educate yourself more about that. There can be even side effects to those alternative therapies. Several herbal supplements can worsen seizures potentially, and there can be even side effects directly from them, rash side effects and digestive side effects. They can even be dangerous and overdose sometimes, and some of them can have interactions with anti-seizure medications such as St. John's wort and ginkgo and herbs that might cause some sedation. Bone health is another important lifestyle issue that is often under-emphasized and under-recognized, because people who have epilepsy have been shown to have an increased fracture risk of 2 to 6 times the general population. A lot of this can be due to the anti-seizure medications, particularly the ones that kind of rev up the liver enzymes that metabolize vitamin D, phenytoin, carbamazepine, phenobarbital, valproate. And it can start as early as 1 to 5 years after treatment. And there can be other risks then that can increase that risk, such as reduced activity, immobility, alcohol, caffeine, smoking are all other risk factors for osteoporosis that are then going to compound the risk. So it's important to take calcium and vitamin D supplements, particularly if you're on these medications, to help prevent that. And then one should have a bone density scan then 5 years after beginning treatment, and then every 2 to 3 years if on any of those medications. This is a slide just to show you how those medications can affect or cause osteoporosis, and you know, the main reason is sun helps produce vitamin D in the skin, and it's also you get vitamin D from your diet, and it ends up in the liver and is stored in the liver. So these medications, they rev up the liver enzymes that metabolize vitamin D. So vitamin D, you get a kind of vitamin D deficiency, and then that's important for bone health. So that leads to then loss of bone density and potentially osteoporosis. Just in my last couple of slides, I just wanted to bring up driving as well, because that's of course a very important issue, and the driving guidelines were updated, and this is the most recent guidelines from February 2013, and you know, I decided to basically show you what it says on the actual guidelines. So in these updated guidelines, and I'm not going to read out the whole thing or go through them all because we don't have time, but basically a first unprovoked seizure, it's 6 months off driving as long as there are no test abnormalities that show that you are at a higher risk or may have a higher risk. Unfortunately, if there is a breakthrough seizure and you do have epilepsy, it's 12 months. And this doesn't display very well, but some of the updates in the guidelines are that there are particular situations where you can continue to drive, particularly if you have seizures only during the night for at least 12 months. You can potentially continue to drive with the permission of the consultant as well. And also seizures that do not impair awareness. If you have only that type of seizures over the preceding 1 year and you have the approval of the consultant, then you can continue to drive. So to conclude, these health and lifestyle issues are extremely important and can be, as important as being on the right medication. You might not be able to control that you have epilepsy, but you can choose to have a healthy lifestyle, and those are choices that you can make. It's important to seek help for all of the conditions that we looked at, if you have problems with them or if they're affecting your lifestyle, and try to live well as best as you can. I'm not a Buddhist, but I do like that quote there at the end as well. Thanks very much.